What's up? So, got a quick laundry list. I'm going to show you 3 different treatments to do. A couple he can do it himself, but he's going to want you to actually help him with it to kind of explore. So we're going to start with the static trigger points, and then the movement trigger points, and then we're also going to look at pin and stretch, and then PIR. Not everybody responds to one of them, but they might respond to the other. So it really is one of those things you kind of have to try all of them. So we're just going to burn through them really quick. I showed you how to find it, right? SEM, kind of look and rotate towards, poke around, you'll know when you're on it. So the first one we're going to do is the static trigger point. This is the money shot. You can do this yourself, you can have someone else do it. So static trigger point, you're going to find it. And again, broad contact, or if you really have to, tip of the finger, and you're gonna press on it, you're gonna hold it, and you're just gonna try to just relax. You okay?
No.
We got one right here. Very much everybody has them.
That seems like not ending.
Yep, there's the pattern. So it might travel down the arm, that's okay too. And then if he's gonna do it himself, all he has to do is go and you'll find that big muscle there, go behind it, poke, and the important part is to breathe into your belly and have decent posture, because this muscle tends to come from stress, being seated a long time, and this kind of posture, which granted with COVID and really nobody's working, we said a lot. So again, poke, press, and just hold it there. You might feel the muscle chill, the pain might decrease. That's just one of them. So the other thing you can do along the same lines is going to be the pin and stretch. So it's going to be find the muscle, it's angry, pin. Oh, sorry, is that too much?
It's okay.
I'm going to fake do it. Pin. And you can take your hand and just push away and look away. Come back. Pin. And you gotta push slowly, because you don't want it to reflexively get taut again and contract. Kind of hold at the end. Good. And again, that's something you can do yourself. Generally, same side hand. Pin. Look away. Stretch. Pin. Look away. Stretch. The other one you can do is kind of like Emma's doing, hold it herself. Oh, that's nice, actually. Kind of like that one. Good job. So that's the static and the motion. And then PIR, which is post-isometric relaxation. This one you do need a partner, unfortunately, but this one is absolute gold when it works. So, remember this one?
Don't.
Okay, so you're gonna have him take the same side hand. If Em's right side is acting up, you can use the right hand. You need a chair or something you can grab here. You're gonna have them lean away just a little bit, so the weight is kind of pulling on this. The muscle actually doesn't attach to the head, the different parts of the spinal cord, the vertebrae, and then down to the first rib, and depressing the rib by pushing down on the muscles that are attached to that will lengthen that bad boy. So have them grab, have them lean, and you're going to very gently keep your hand on the shoulder, and you're just gonna pull the slack out. It's not a stretch, it's just thinking about slack. And you're gonna have them look away just a little bit, and here's the important part is just breathe normally. Big deep breaths into your belly, nice and relaxing breathing like we've talked about a million times before. And then you're gonna have them take a big breath and hold it. You do this for 5-ish seconds. Go ahead and completely relax, let your breath out. And this is the important part. They're gonna relax and you're just taking the slack out. Again, it's not a stretch, it's just a very gentle pushing. And I don't know if you can see it, but I can feel it. Things are starting to relax. We're gaining a little bit of length. And then after 10 or 20 seconds of this, really whenever the length stops, go ahead and take a breath in. Keep going. And then in the middle of this, you can ask them to push against my hand only about 5%. You're just gonna feel a little bit of pressure, but it's really nothing. Quite literally 5% of what they got. Go ahead and relax. There you go. Yep. So you're going to do a couple of rounds of that. Basically, you're going to have them just give you 5%, hold the breath, count to 5 or 10, totally relax, and then let the slack out. The most important part of this is going to be the end, where they don't move their head, you do. So you're going to bring it back, completely relax, and forth. You want to go as far as you can on both sides. Ideally, you're behind them, but the bed is awkward, it's not a chair. You want to bring them all the way where the patient is not doing anything, it's all you. So, go ahead and do that. 3 to 5 contractions generally gets the job done, but do start with trigger points first, because that's usually what needs to be done first. The reason why stretching doesn't always work for trigger points, we don't actually know the reason, but we know that that's a thing. You can't just stretch a trigger point away. In most scenarios, you have to like either ischemic compression, which was the static stuff, or the PIR. So those are your 3 general treatments. There are ways to modify it, so let me know if those don't work. So the most important part is going to be like the recommendations and basically the causes of it. So the causes of this, like we briefly touched on, was lots of sitting, lots of forward head posture, lots of being rounded here, typing, being at a desk, whatever you got. And as Em knows, because I recommend all the time, there it is. Every time you're here, right, all day, you gotta do the opposite. Bring it back, head back.
If you have a roller, lay on that and do this on the ground.
Yep. Do revisit that video that I showed you about wave breathing and how to self-adjust, because laying on a roller or even just laying on a bed with your head back and belly breathing. One of the other causes of this is general stress. I know that you're like me, Kavya, where when you're stressed, you're a kind of person and you don't really notice, but then like you start getting headaches and these weird like neck strain headache situations. I actually can feel it going on now. It's never fun. And so when you feel stressed, an important thing again is going to be going to the opposite. Really open the mouth. Big breaths into your belly. Let it expand your ribs, and just big relaxing breaths into your belly. And if you got a yawn like that was great timing. Go ahead and do that too. So what else can we do? So movement. If you're sitting for a long time, get up every hour or so. If you have to set an alarm, do it. Honestly, I have to do it when I'm studying like 6, 8, 10 hours a day. Get up 5 minutes, move, twist, just do something. Don't be in the same position too long. There's no such thing as bad posture. It's any sort of chronic, long-standing, static posture that's really bad. We always think of like, this is good posture. There's actually something called flat back syndrome where you're like this all day. Military posture. They're gonna have the opposite pains of you, but they're still gonna have pains. So this is fine, just not long-term. This is fine, just not long-term. Movement is medicine. And then there are some exercises you can do. They are very, very strange, and I apologize in advance, but there's 2 of them, and we're gonna see if we can get the camera angle because I don't know how it's gonna work. But the first one is gonna be interlace your hands, bring it here, put yourself in that forward head posture that we don't like too much, and then try to use your head and your neck to bring it back. Because what the scalenes do, they flex you this way, they rotate you, but they also stabilize when you're out here, and you can strengthen them by bringing it back here. And it's gonna be an isometric contraction, so you're not really like doing reps like you would in the gym or anything. It's very much just bring it to end range, give yourself a nice solid stimulus, hold it as long as you can. You might get a headache. I'm getting one now, it's a fun one. Try a couple times a day, 3 sets, 10 to 30 seconds, build your way up and see what you can tolerate. The second one, not really sure how this is gonna go, but we're gonna give it a whirl. No, it's gotta be this weird, awkward down here thing. Oh, that actually works really well. So, like we said, the scalenes stabilize, and so basically what you're going to do is it's two parts, right? We said you're going to bring it back here, so you want to basically tuck the chin and keep it tucked. You can't let it go out. When you get tired, that's what's going to happen, and that's when you know you got to stop. So you're going to tuck the chin as if you're like pushing into the floor, and then keeping the chin tucked, you're actually just going to raise your neck and your head off the floor like a centimeter. So tuck, bring it up, and you're just going to hold it. It's actually really hard. And it's, yep, okay, I'm shaking. So that's something I got to work on as well. Hold it as long as you can. Aim for, I don't know, 3 to 5 sets of 10 seconds. If you develop a headache in the skull area, totally normal. If the front of your neck is getting kind of angry, then chillax. Either hit the trigger point thing or just call it for there and then start again some other time. Unfortunately, the scalenes respond very, very well to the manual therapies that we did in the first part of this, but that doesn't address the underlying problem. So you do have to address the habit, but you also kind of have to address the symptom. It's one of those vicious cycles where if you don't address the symptom and you try to exercise it or stretch it, it gets pissed off, gets worse, and then you're sitting longer because you're debilitated, and that's the cause. It's just a vicious cycle, causes itself over and over. So, recap. We got the trigger points, both static and with motion. We have the PIR, post-isometric relaxation, which does require a partner, but it is generally the better of the three. And then we have the exercises, the two that we just did, and most importantly is less sitting, or at the very least, more motion. Okay? Let me know if this helps.